Data in the EMS space has been around since around 2010. At least its adoption is, for the most part, nationwide. Agencies out there are looking to become more data-driven. In our particular organization, we've been very data-driven, which has helped us improve the quality of care that we provide to our customers, which includes the patient, the hospital, the nursing facility. And I think that if you're truly a data-driven organization, ESO is a major player in the market to help you achieve that solution.
The more data we have on something, it helps either improve change, improve outcome, improve response times all the way down the road.
When you start seeing trends on how things are handled, how long it takes to get an IV started, what happens when you don't start that IV and it takes 3 or 4 attempts, what is the survivability change in that patient? So before you wrote a lot of reports and you really didn't see that data, but now that you have access to it, it allows people to learn from it and areas to help adjust what they need to do in their specific areas.
I believe that much of the data we collect starts at the continuum point of 911 activation, and I think that one of the important manifestations of all this data collection will be better dispatching and navigation of people away from hospitals, transport services, and into either online care, home visits, or other therapies that do not involve tying up emergency departments and acute care facilities.
Provider safety is huge. It makes you feel so good to be a help, and that can be rewarding that it then overshadows the financial impact. And so I think that we need to do something to try to address that.
The industry has been looking into mental health for the providers. I think a lot of people take certain calls for granted. They're seeing more suicide rates with those individuals, PTSD for certain things, because you see a lot of bad calls.
ESO has really helped out with looking into the financial and even the mental health because they're using their data on a large scale. It's one of the first times with the work of the large data forums and the conversations where they're collecting all this nationwide data instead of just in these little small pockets for a service to look at their data to see, what is our true workload of our providers.